My name is Hadi Zambarakshi. I'm a consultant ophthalmologist at the Spire London East Hospital. So the most common reason for having blurred vision is that the patient might need their spectacles updated or changed. So an eye test is what's required initially. In patients over the age of 70, cataract is a common reason for having blurred vision. But in general, one has to think of various other possibilities, which would include the retina, the optic nerve, the cornea. So in short, it is important to examine the eye completely to understand what is the reason for the vision being poor. And of course, it is to do an eye test as well, as I said earlier. Thank you. It is possible to correct cataract and astigmatism by using a special type of lens at the time of cataract surgery called a toric lens. However, it is important to obtain a comprehensive examination of the cornea prior to surgery called a corneal topography, in order to understand the degree of astigmatism and the angle of astigmatism. It is possible to minimize the need for spectacles after cataract surgery by using a special type of lens implant called a multifocal lens implant. There are other ways of reducing the need for spectacles, and that is by achieving monovision, whereby one corrects the dominant eye for distance and the non-dominant eye for near, and as a result, the patient would have improved vision both for distance and for near. But when you have monovision, you are not binocular. When you have a multifocal lens implant, you are still able to have binocularity. Monovision is great, and patients usually love it because without using a multifocal lens implant and without having the possible side effects of multifocal lens implants, it is possible to give the patient both distance and near vision, whereby one corrects the dominant eye for distance and the non-dominant eye for near. And the more you make the non-dominant eye short-sighted, the worse the distance vision, but the better the near vision. However, the dominant eye would still be seen for distance and therefore would compensate for the reduced vision for distance in the non-dominant eye. I hope I haven't confused you very much. Cataract surgery is not painful. Cataract surgery is, of course, an operation. It is done in the operating room in totally sterile conditions. And if a patient is anxious before the surgery, it is possible to give the patient either a small Valium, which will just relax him a little bit, or also possible would be to give the patient a low dose of intravenous sedation, so using a small cannula at the back of the hand to make them that touch more relaxed and comfortable, and that usually makes the surgery much easier. But it is not, as a rule, an unpleasant procedure or a difficult procedure. In some patients, it is possible to give a local anesthetic injection to numb the eye completely to make the procedure completely painless. If a patient has distorted vision, then it is important to report that, in particular if it's of a recent onset. And in general, having distorted vision is caused by a problem with the retina, and usually within the area of the retina called the macula. So this is the central part of the retina. And there are many different reasons why the macula may be affected. This could be because of a scar on the retina called an epiretinal membrane. This could be because of a macular hole. Or it could be because of something a bit more serious, such as macular degeneration, in which case it is important to differentiate dry from wet macular degeneration, because wet macular degeneration needs treatment with injections, whereas the dry type does not benefit from injections. It is important for all patients who have a strong family history of macular degeneration to have regular eye tests, perhaps from the age of 50 onwards. And that usually means seeing your optometrist once a year for an eye test and for a dilated retinal examination. If the optometrist identifies signs of macular degeneration, then they would probably refer you to a retina specialist or an ophthalmologist so one can have a slightly more detailed examination and consider whether any treatment is required. Macular holes are a surgical problem, and the treatment is through a procedure called a vitrectomy, which also involves injecting gas in the eye. Whilst the procedure is not an emergency procedure, it is best done within a few weeks of diagnosis, if at all possible, in order to obtain and in order to get better visual outcomes. The surgery is done under local anesthetic as a day case, and we usually give a small dose of sedation to make the patient more comfortable during the procedure, and it usually takes roughly about 50 minutes to do the procedure.